My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. This video is going to be about total mortality, comparing plant-based diet to standard diet. All right. Now, what does the research show? First of all, the type of topics I'm going to go through in terms of research are total mortality, which is going to be this video. I'll talk about heart disease, stroke, various cancers, including total cancer mortality, colon cancer, breast cancer, prostate cancer, and some other cancers, as well as obesity, diabetes, and a few other things. I'm going to talk about dementia. There's some studies coming out suggesting about plant-based diet and dementia and protection from that. Alzheimer's disease, also dementia, Alzheimer's, constipation, diverticulitis, and maybe a couple of other things that there's evidence for. So let's talk about total mortality. Okay, 1999 publication, associations between diet and cancer, ischemic heart disease, and all-cause mortality in non-Hispanic white California Seventh-day Adventists. So it's an interesting study. Okay, they followed 34,000 people over 12 years. It's the Adventist 1 group of studies, so they didn't have vegans in that group of studies, but they followed people who are vegetarian versus standard diet. Okay, and what they found was that there was 37% less cardiovascular death in the group of vegetarians, so that's death by heart attack, and 88% less colon cancer, 54% less prostate cancer in that particular study. Okay, there was some benefit in other cancers, okay, but vegetarians lived about 3.2 years longer if they were men and 2.5 years longer if they were women in this group. Now, what are the strengths of the study? The strengths of the study are that it was for 12 years long. They had 32,000 people. They had 32,000 people. They were well controlled. The different people had, similar amounts of smokers and drinkers and all these kind of things. So the main variable was diet, and they did control for the other factors, and they did look at them. So that's good. Okay. Some of the weaknesses: they didn't have a vegan subgroup. Possibly a vegan subgroup would do even better than the people who are vegetarian and having, let's say, some dairy and eggs and saturated fat, cholesterol, animal protein in their diet. But that remains to be seen. So there's new studies looking at that. All right. So that's good. Now, the meat-eating group in that ate very little meat. They ate very little meat. So the fact that you can find a difference in a group, it's like saying that, like I was saying before in the previous video, somebody smoking only 1 or 2 cigarettes a day, and you watch them for 12 years, do they actually have more disease than a non-smoker? We know that they would if they were smoking a pack a day, but would 1 cigarette a day really make a difference? We're not sure. We've never done that kind of study to my knowledge, but in this case, people who were even having a small amount of meat compared to people having no meat, there was an advantage in the vegetarian group. Okay, so that's an interesting thing amongst this population, that where there was only a very narrow difference overall between consuming meat and not consuming meat. Okay, so that's interesting about the study. As I mentioned, they didn't break down things in terms of semi-vegetarian, vegan, people only eating fish, but that's still one of the most remarkable studies that have been done to date. Okay, here's one from the second batch of Adventist studies, so the Adventist 2 study that's going on right now. So this is a study where they're looking at even a greater number of people. They have it divided into vegan, vegetarian, semi-vegetarian, fish eater, and standard diet. Again, there's narrow differences. The meat-eating group has lower amounts of meat than the standard American population. But in this publication came out in 2013, Vegetarian Dietary Patterns and Mortality in Adventist Health Study 2, 2013, JAMA, Journal of the American Medical Association, great journal. 73,000 subjects followed only for 5.8 years, so they're not following them so far for a long time. They're going to have to watch these people for a longer time to really see what happens, because you're not expecting a lot of people to die just in 6 years to see who lives longer. But in that time, there was 15% less death amongst the vegetarian groups, so vegan, vegetarian, and so forth. Even fish eaters, sometimes they lump them in with vegetarians. They all had a similar less mortality as compared to those eating the standard diet. Now, subdivisions between the vegans, vegetarians, and fish eaters can't really be determined as of yet. That's going to be something to be seen as they watch these group of people for another 5 years, another 10 years, and let's see what happens and who comes ahead. Okay, so that's a good example of total cancer mortality. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one, and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people, and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.